come back to that theme of we'll come back to that theme of implementation and dissemination. It will apply across the board, but thanks very much for that. Shelley.
Thank you. First, I'm truly honored to have been here. It's been outstanding. And what I learned over the last couple of days was incredible and exciting, but also very dismaying. Because the question I have that I hope those of you in the area of mental health can help us in justice with is, why don't we know about what you know? It's not hard on our radar screen. Even though mental illness is a significant part of our pie in justice, it is not the most politically driven part of the pie, and our system of justice and law enforcement is politically driven, up to and including appointing justices to the Supreme Court. If I had one request that we take out and think about, we're all in this room because we care about the quality of service and support to people who have mental illness, particularly for this dialogue in regard to opportunities to prevent and intervene in violence. If that is our goal, and that comes after the equal sign, what should the formula look like before the equal sign? On a grand scale, a common formula that we can all embrace and then refine down for different aspects of the so-called system, whether it be police or corrections or the psychiatric community. What's the formula look like, and is there one that we can all agree on? In regard to specific areas of research, I would like to see, and you may be aware of it, but I wasn't able to find it, more research on initial information, and I addressed this earlier, conveyed at the first point of contact with the system, whatever the part of the system is that the person who has mental illness is connecting to, whether it is a 911 call to police or walking into a clinic. How does the initial information that's conveyed, whether by the person or a family member or someone else, shape what happens next? Short-term intervention and even long-term intervention. I'd like to see research on managing fear. The term stigma came up a lot, but not fear. And I believe, particularly from the police side, that it's people's fear of what will occur after the contact that inhibits them from coming forward or being totally honest in regard to what the situation is that's come forward. And we need that work on fear in order to develop higher levels of trust across the professions, but particularly in regard to service to the individuals. We need that understanding to help us counter the barrage of grossly exaggerated information that the media is putting out that's evoking even greater fear relevant to this issue of violence and mental health. I'd like to see research on research. What happens to the research? Why doesn't it get down? We talked about dissemination pretty freely the last couple of days, but we haven't talked enough about why it doesn't get down. We know we have it, it's good information. Colleen just touched on that. What are the inhibitors from getting the research into the hands of the frontline professionals so they can be applied on a grander scale? In regarding policy, very quickly, I'd like to see us come together to foster policy and even mandates to provide better education and training, particularly to young people coming into all of our fields for the sake of the future, so that someone coming into any aspect of mental health has a genuine understanding of public safety and vice versa across all the fields that are represented here. And let's start building the next generation of professionals and practitioners a little differently. How do we go about that? And then in regard to scaling up, I'd like to really see us come together to put pressure where it needs to be put to scale up the crisis intervention teams. We know they work, and they're going away and we need to stop them from disappearing, which is the direction we're headed in. And most importantly, in my close is in regard to scaling up, and I mentioned this earlier too, but I'm passionate about this. We need to scale up learning for people who have mental illness and their families so that they know better how to engage the system, particularly if it's an emergency involving police or fire EMS, to make the system work better for them. Thank you.
Thanks very much, Shelley.